Thanks. I did do the potash study that came out recently for the Governor of Saskatchewan, but I will not be taking questions on that today. So I think I've had enough on that file for now. Very happy to be here with you today and to talk about this work that the Conference Board's done for the Ontario Long-Term Care Association. It's interesting to hear, to contextualize the ministry perspective, and as I present our work, think about this. In Ontario, you have an equality and innovation agenda that is looking at emphasizing collaboration within the sectors and across the full range of healthcare sectors, patient or person-centered, continuous improvement, efficiency themes. There is a government appetite for transformation within this changing context of rising demand and the fiscal pressures of government across health and beyond health, and ultimately a part of transforming the whole healthcare system. So we're living in a world where Ontario's changing here, so are other jurisdictions, and I want you to keep that in mind as we talk about this work. So we enter into into this work with three goals in mind, three broad goals. Firstly, we wanted to understand what are the options, what's the capacity given the trends in demography and resources. What's the capacity issues for the, I'll call it LTC, long-term care, LTC sector to fulfill its role. Secondly, what kind of things could be done, what kind of innovative things could be done to sustain the sector, to grow it, to change it, to fundamentally enhance its capacity? And what options does it have to play a leadership role in a broader transformation of healthcare? And I think there's something significant that could be done there with the right engagement across this sector. So those are the broad objectives. We followed a methodology with the usual sort of methodology with literature reviews. We interviewed a lot of the key players. We looked at the literature in the environmental scan in other jurisdictions, domestically and internationally, analyzed that, and have written up and consulted with folks around the results, and then we are just about finished with preparing the report. So that's the high-level findings. There's four things I want to mention here, and then I'm going to get into some of it. Firstly, this sector, the LTC sector, could significantly expand its contribution. It could play a bigger role. Secondly, the success of some of the Ontario government's strategies in fact will depend on the capacity of this sector, and maybe more than you realize. And that's a movable feast, but you can certainly play a bigger role there, and the government will, I think, embrace that. I'm speaking as the Conference Board here. Thirdly, this sector will need to innovate in order to improve its productivity, its capacity to offer more, and its ability to integrate with the bigger system. And fourthly, there are indeed some internal and external barriers to doing that. Some of it is within the customary pattern of activity in the sector. Some of it is the forces outside. So I'm going to speak to a little bit of all of these. In terms of trends and challenges, first thing is this sector cannot keep up with the existing demand, let alone what the future demand is going to be. If we say by keeping up, we mean, is there a place for everybody who wants to be in the system? And the answer is right now there is not. There's a substantial waiting list, and that's likely to grow. There are, in fact, pressures of quantitative and qualitative type. One of them is around the quantity of folk who will demand attention. And here is a graph showing the blue line is the expected demand based upon not a substantial change in the uptake, but recognizing the change in demography and some of the characteristics of the population. Demand rising, more than doubling to 2035, and at the same time the supply, that is the capacity to meet the demand, is, depending on which scenario, the gap grows. That's the key point. The gap grows so that and not surprisingly, in light of the demography, by 2035 there will be about, when the baby boomers are 71 to 89 years old and still not planning to leave the scene, there will be about 238,000 versus 98,000 Ontarians in need of long-term care. This is a very substantial change, and addressing that is going to take some work. So, what to do? Well, first of all, to understand the change in the nature of this demand. Part of this is around the needs will have changed due to demographics. All things being equal, if you have an older population, which we will have, in every scenario it will be older, then the demand for attention grows. The kinds of demand, dementia, other mental illnesses will be prominent in this sector. And we can say, looking at this, and here's some numbers, every one of those, from the dementia, diabetes, all the way down to our emphysema and arteriosclerotic heart disease, all of those numbers double by 2035, or more, actually more than double. So this litany sees every category more than doubling in this period of time. In addition to the numbers, there's some other things going on. The new old will exhibit more, the trend is for them to want more independent living arrangements, more autonomy, greater choice of services. In other words, higher expectations. They have higher expectations. In addition, there's a changing profile, a diversity. The population of Canada is becoming more diverse year by year. Approximately, our forecast is that the immigrants to Canada will need to grow to 360,000 per year by 2025. In other words, about 1% of population annually, in order to sustain the labor market, in order to give us enough people to produce what we want to live well. With that diversity of population, there'll be new expectations in your sector. And there you see some rise in the numbers seeking care. New strategies are emerging. I mentioned the changing the mix, again leading to higher costs. All things being equal, if we optimize the healthcare system, which is to say we follow along the route of adding to home care, those who can be safely and well cared for at home, then on average people will need more attentive care in institutions. And that's going to change the cost structure over the next 25 years. So, at the same time, you have an interesting pattern, the rise in the number of folk seeking this care is not being matched by a number of people working, and you in fact have the ratio of the working age population to those over 85 is going from 19 to 1 to 10 to 1. If you do other ratios around the working population and the rest of the population, you compare young to old, you compare workers to non-workers, all the ratios show this great stress. And I remind you that when Prince von Bismarck created the retirement system in Germany circa 1870, he got his officials to do some numbers, and they did come up with the numbers. They said, let's set retirement at 65, and he said, okay, fair enough. How long, for German men, that's who was working, and what's the average life expectancy? And the answer was 61.7. So they had a good little, they had a negative 3.3 to play with there on the numbers. Well, today the retirement ages are still about the same, going up gradually in Europe, despite the strikes in France, and they will continue to go up all over the world. But the gap is there, and so there's pressure on all of us on how to do this well. And the answers are regulation certainly needs to be there, despite the over-regulation concerns. But financing it on a shrinking tax base means we have to be innovative, and we have to use all kinds of things to do more with relatively less compared to the demand. So what are the options for long-term care? Well, I'll remind you, first of all, you heard from Minister Murray about innovation. Here's the Conference Board's definition of innovation, process through which value is extracted from knowledge by generating, developing, implementing ideas to produce new or significantly improved products, processes, and services. In fact, our estimation is that, as somebody said, it may have been me, I don't know if it was me, but let's say it's not me, because if I'm saying innovation is not invention, I don't have to invent that, right? All right, it wasn't me. I'm borrowing this from a colleague. Innovation is incremental. We think at least 2/3 of it is incremental. Although invention gets the attention, and it's important, There's a heck of a lot of innovation that is incremental. That means you take something from one place, use it elsewhere, or you take what you have and you tweak it to make it more refined, or you target it better. In a variety of ways you can innovate. And innovation in large systems takes place at every level. I was speaking in Edmonton last week with a guy who was head of people for WestJet. And he gave a great story about on their planes, the two flight attendants came up to him on the plane and said, the water you use for the system, the toilet system is stored, and he said the gauge never goes down at the end of the flight. And then they checked into it, and it turned out they were carrying way too much water. Water equals weight, weight equals fuel, fuel equals money. So they changed the system to match the water usage to the water need and saved $7 million a year. That, I thought, I need staff like that at the conference, but that was outstanding. There are other examples. Point is, innovation doesn't have to be complex. It just has to be thoughtful, and there has to be an appetite for it. So, why innovate in long-term care? Well, I think the short answer, innovation is a necessity. And that's a mindset, to accept that, to embrace that, to say, yeah, we actually must innovate, and we must embrace it, recognize it, reward it, is an important breakthrough for the sector. There are huge opportunities to contain costs and improve the care at a lower cost than, and compared to the acute care system, you've got a lot of room to work in that will be advantageous to government. And you have to meet rising expectations. There's the revolution of rising expectations. Customers want more. People want more. If you do this right, you can improve health, you can improve the quality of life outcomes for your residents. You also will change the experience for the people who work with you. The morale of the people will be better. You're going to recruit and retain them in work. Your reputation goes up, especially if you build in some of this strategy into your public relations, into your media, into your outreach. You get a very positive impact on staff, and for the for-profit operators, in the end, that reaches the bottom line. There have been some calculations of this. The Australia's Productivity Commission found that their long-term facilities, if they were to operate on a best practice frontier and using economies of scale, so it wasn't everybody doing everything all the time, they would pick up an extra $1.6 billion annually. Now that's the kind of numbers that attract attention in government, and they should attract attention inside the sector as well. We came at this and said we think there's three ways in which you can actually innovate. You can innovate in the first one is we call it internal. That means within the firm, within the organization, within the institution, the individual institution. Secondly, sector. That means LTC. And thirdly, the integration and transformation piece. That's across the whole healthcare system. So I'll say a little bit about each, just a bit about each. And the report's going to have lots more in it. This is about what can you do on your own in your own institution. And there are a number of things that you can do there around the people. People, it turns out, are a big issue. Getting the right people, keeping the right people, developing them so that you can connect an HR strategy with an innovation strategy. There's a lot you can do there on your own. More we'll see with others. You can also enter into research partnerships where you can tap into a lot of the talent in the post-secondary system, which does research, which can help you understand how to address, in a very positive way, the diversity of that customer people base of folks to whom you're delivering care as that group is changing. So you get the latest things, and you get the niche segmentation, and that's available through research partnerships. You can also outsource admin, financial. Lots of organizations in the business world, of course, are doing this more and more and trying to get that right. Government, too. Shared services is, in effect, a system of outsourcing within government to create a more effective centralized system.